नमस्कार। भारतीय पुनर्वास परिषद की ओर से मैं आप सभी का स्वागत करती हूँ। टेलीकॉन्फ्रेंसिंग श्रृंखला की यह हमारी 7वीं कड़ी है। अभी तक हम आपको हियरिंग इम्पेयरमेंट, मेंटल रिटार्डेशन, विजुअल इम्पेयरमेंट, मल्टीपल डिसेबिलिटीज़ एंड सेरेब्रल पाल्सी के अर्ली आइडेंटिफिकेशन और रेफरल के विषय में जानकारी दे चुके हैं। आज हम आपको लोकोमोटर डिसेबिलिटी के अर्ली आइडेंटिफिकेशन और रेफरल के विषय में जानकारी देंगे। आज इस विषय पर जानकारी देने के लिए हमारे साथ बहुत ही महत्वपूर्ण विशेषज्ञ मौजूद हैं। मेरे दाएं ओर हैं डॉक्टर एच.सी. गोयल। आप वर्तमान में एडिशनल डायरेक्टर जनरल हेल्थ सर्विसेज हैं और सफदरजंग अस्पताल में रिहेबिलिटेशन डिपार्टमेंट के हेड हैं। डॉक्टर गोयल पिछले बहुत लंबे समय से विकलांगता के क्षेत्र में जुड़े रहे हैं। भारतीय पुनर्वास परिषद के साथ डॉक्टर गोयल का बहुत लंबा रिश्ता रहा है और वर्तमान में आप हमारी जनरल काउंसिल के मेंबर हैं और इसके अतिरिक्त कई कमेटीज़ के एक्सपर्ट कमेटीज़ के मेंबर भी हैं। मेरे बाईं ओर हैं डॉक्टर धर्मेंद्र कुमार। आप पंडित दीनदयाल उपाध्याय इंस्टीट्यूट ऑफ फिजिकली हैंडीकैप्ड में डायरेक्टर हैं और आपका विकलांगता के क्षेत्र में बहुत लंबा अनुभव रहा है। कार्यक्रम को आगे बढ़ाने से पहले मैं आपको अपने फ़ोन नंबर नोट करा दूं। आप अपने सवाल इन नंबर्स पर पूछ सकते हैं। हमारा टोल फ्री नंबर है 1600112345। एक बार नंबर मैं फिर दोहरा देती हूँ, 1600112345। STD नंबर है 01129532844। दूसरा नंबर है 01129532845। एक नंबर और भी है 01129536131। इसके अलावा आप अपने सवाल हमें फैक्स भी कर सकते हैं। हमारा नंबर है 01129536134। मैं आप सभी लोगों से गुजारिश करूंगी कि जब हमारे विशेषज्ञ अपनी जानकारी दें या जो लोकोमोटर डिसेबिलिटी के अर्ली आइडेंटिफिकेशन के विषय में बता चुके, उसके बाद आप अपने सवाल इनसे ज़रूर पूछें। सामान्यतः देखा जाता है कि एक्सीडेंट होने, चोट लगने, पोलियो या अन्य किसी कारण से लोकोमोटर डिसेबिलिटी हो जाती है। आइए हम जानते हैं डॉक्टर एच.सी. गोयल से कि लोकोमोटर डिसेबिलिटी की शीघ्र पहचान यानी अर्ली आइडेंटिफिकेशन कैसे किया जाए। डॉक्टर गोयल।
थैंक यू डॉक्टर हेमलता। सबसे पहले मैं अपने दर्शकों को थोड़ा बैकग्राउंड देना चाहूँगा इस फील्ड की। सबसे पहले हम चलते हैं कि डिसेबिलिटी है क्या। तो जैसा आप देख रहे हैं स्क्रीन पर, डिसेबिलिटी is the difficulty in performing the activities which are essential basic components of daily livings. Now we all know that there are essential component of daily living like taking care of self, then transfer activities. One is moving from one place to another, that is the mobility activities. Ladies have to do certain household activities. Then people have to go for jobs, there are job activities, and one has to communicate with each other in day-to-day life. So these are the various activities which if a person is not able to do like a able-bodied person is able to do as per his age and sex and social normative behavior in the community, that person is having a disability. Just to give you an example of this, now if we take a person who is suffering from leprosy, say, and now he has developed certain typical deformities. Those deformities, as you know, are in the form of loss of digits. There may be ulcer, loss of digits of the fingers, of the toes. There are some deformities of the face. So, because of that, the person is not able to perform certain skillful movements. So, that is actually that he is not able to do his activities of daily living. He is not able to dress himself, he is not able to eat himself. So, that way the leprosy is contributing towards the disability. Similarly, if you take a child, now the child is not growing normally as he should grow. Suppose he has not developed neck holding up to the 3 months time as a normal child should do, or person is not able to walk as a normal child should be able to walk at the age of say 1 year or 1.25 year. So, that person may be having a disability. So, that is how we define disability. Now, coming to the today's topic, that is the locomotor disability. Now, locomotor disability, we define this as a disability when a person is not able to execute distinctive activities which are associated with moving either himself, either he is not able to move himself, or he is not able to move the objects which are around him. And this inability of moving is results from the affliction of the musculoskeletal and or nervous system. So, like that, if you can take an example, we can take an example of a person, suppose he has suffered a stroke, that is a hemiplegia. So, his right side upper limb and right half of the body, that is not functioning properly. So, because of that, he is not able to move himself from one place to the another place as a normal person should do. So, that is the locomotor disability, and it is arising because of a dysfunction of the brain. So, there is some problem in the brain, that there is some damage has occurred to the brain, and because of that certain functioning of the body are disturbed. So, that is what we call the locomotor disability. And quickly, if we go through the disability process, that as you are seeing on the on your monitor, that for a disability to occur, there is a disease which gives rise to an impairment, and that impairment leads to functional limitations in the form of that, again, as what I was telling you, that the activities of daily living he is not able to perform, and that results in a disability, like the person is not able to work as a person of his age or sex should be able to do, and this disability may lead to an handicap, that is a disadvantage of a person because of certain problems in the society, like a barrier problem or some social problems. So, that is the disability process. Now next we come to the next slide, and that will show you the various magnitude of the locomotor disability. Now, here you can see on the monitor that we have 1.85 crores persons with disability in our country, and who contribute to about 1.8% of a total population. So, it is a huge number, and out of this, people with locomotor disabilities are 57.5% of the total population, which amount to a figure of 1.06 crores. So, this is actually the largest number of persons with disability belong to this category. Now, we will quickly go through the various causes of locomotor disability, and as in any academic program, we classify them in order. So, first we come to the congenital causes and the developmental causes, which, as you can see on your monitor, the first cause is cerebral palsy, then this is a deformity of the feet, which is called club foot, then there may be loss of the limbs, congenital absence of the limbs, which we call as phocomelia. Then there is another condition of the spine, that is called meningomyelocele, in which the person may have got either paraplegia or quadriplegia, and another important cause is the congenital dislocation of the hips. So, these are very common congenital and developmental disorders. And next we move to the another group, which are acquired later in life. And next, this group is the infective group, that there is some infection in the body giving rise to a locomotor disability. Common ones are tuberculosis, then poliomyelitis. You must be aware of all these. Then leprosy, as I was talking to you. Then encephalitis, then Guillain-Barré syndrome, septic arthritis, chronic osteomyelitis. This belong to the infective group. Now, this is another important group, that is the traumatic group. Now, in traumatic, as you know, that the number of accidents, they are on the rise, whether it is traffic accident, it may be on the road or on the rail or in the air or even in the water. And then the other causes of accidents, as you can see, that there may be agricultural accident, there may be industrial accident, there may be domestic accidents. Then you know that in our in the world, the violence is on the increase. Every day you listen in the newspapers, there is some news of some violence occurring somewhere. The natural catastrophes are also taking up large number of toll of the people, as well as a lot of people suffer with disabilities. You know, the tsunami incident, the devastation it has caused. The next group which we will take is the after accident, we will take the next group, that is the metabolic causes, that there is some disturbance in the metabolism of the body, and that is giving rise to locomotor disability. Now, out of that, one is rickets. As you can see in the diagram, that the child is having a number of deformities. The deformities there at the knee, then he is having a pot belly, and also there are other deformities which are not seen in this diagram. Then diabetes mellitus is another cause, metabolic cause, which can give rise to substantial disability. Then vitamin B12 deficiency, and then gout also is a metabolic disorder which can give rise to pain and deformities in the joints. Next, we come to the tumors. Now, there are variety of tumors are there which may be arising out of the bone, like osteosarcoma, in which the disability is usually in the form of amputation. That wherever it is, that we may have to amputate that part of the body. As you can see in this photo, that the child is having a amputation below the knee joint. Then other tumors, they may be arising from the spine itself. There may be astrocytoma, meningioma. Then tumors may also be arising from the brain. So, next group is the vascular group. Now, in vascular group, cerebrovascular accident is one major chunk which we term as a stroke, and normally it gives rise to hemiplegia. The person is having weakness of one half of the body. Along with that, there may be some associated problems depending on the damage to the brain. Then there are peripheral vascular disease that may also lead to amputation. The another disease, common one, usually in this child age group, that is the Perthes disease. Now, Perthes disease also is a disease which gives rise to joint damage and consequently leading to disability of moving, that is the locomotor disability. Now, next we will be coming to the next presentations in locomotor disabilities, and that is let us go through this final slide of this causes, that is the degenerative group. Now, in degenerative, we have got a number of neurological conditions, motor neuron disease, Parkinson's disease, multiple sclerosis, then osteoarthritis and spondylitis also contribute to lot of cases having locomotor problems, mobility problems. Then there are other group, miscellaneous group, and the muscular dystrophy, although not very common, but it is a very serious locomotor disability. Then rheumatoid arthritis is another disease which contribute to deformities, and patient is having a locomotor disability. So, that is in short about the causes of the disability, and if we go as per the sites, then we can classify these causes into, if it is arising from the brain, as I was telling you, then it may be a cerebrovascular accident. If it is arising from the spinal damage, then it may give rise to a paraplegia, or if it is in the cervical level, then it may be quadriplegia. If it is involving the radicular region of the nerves, then it is radiculopathy, giving rise to weakness or pain. If it is relating to the nerves, then it is peripheral neuropathy. Similarly, if it is relating to the bones, then the patient may be having either a fracture or some tumor, giving rise to a locomotor disability. So, that is according to the sites that we classify this disability. And next, then we will show you another slide, and that is on this presentations in disability. That is disability, locomotor disability may either present as a paraplegia or a paraparesis. That means there is a weakness or paralysis of lower half of the body, or it may be monoplegia. That means there is a paralysis of one limb. It may be either upper limb or lower limb, and if it is weakness, then we call it monoparesis. Similarly, hemiplegia, that is one side of the body is paralyzed, or hemiparesis, that is one side of the body is weak. Next is quadriplegia, that is the all the four limbs are paralyzed, and quadriparesis is, that is all the four limbs are weak. Then amputation, that is loss of a part, or it may be a deformity, or there may be associated symptoms like pain and spasticity, etc. Now, as Dr. Hemlata was asking about the early identification of locomotor disability, now in all these group of causes which I have shown, patient broadly present in three forms. Now, first is the weakness. As you can see this child, the upper limb on the left side, that is paralyzed. So, either the person may be having weakness, or he may be having a deformity. As you will see in the next slide, this child is having the deformity. This is a congenital CTEV, as I was telling you in the causes. This is a congenital talipes equinovarus deformity. And the third commonest presentation is the loss of the limb. That is, this person, his limb, right lower limb below the knee, that is lost, maybe because of the accident or any other cause. So, commonly you will find that either there is a weakness, or there is a loss of that limb, or that limb may be deformed. Then you can also look for associated problems in such persons, as you were seeing in the previous slide. Just go for the previous slide, then you can just see these associated problems. That person may be having either pain or spasticity, that is the tone of the muscles is increased. There may be stiffness in the joints, there may be sensory loss, there may be bladder bowel problems, then there may be other impairments, associated disabilities. That may be sometimes the locomotor is associated with mental retardation, or speech and hearing impairment, or visual impairment, or a combination of all these. Now, I have told you that broadly this patient of locomotor disability can be identified by looking into whether person is having any weakness, or a loss of a limb, or a deformity of a limb. But in borderline cases, we have to perform certain tests. Now, the first test, there are 6 tests. Now, first test is that we ask the person to perform this test, that is lift the arm overhead. So, one person is lifting both the arms overhead, then grossly we can know, if he is able to do it normally, then we know that there is no dysfunction of the upper limbs. Similarly, is the next test, that is that we ask the person to walk a short distance. Now, walking a short distance, then you can know if the person is walking normally, that means he is not having any problem of the legs. Then we can first ask him to stand upright on both the legs, by which we know that his spine is okay and his legs are okay. then stand upright on each leg alternately. First he stand on the right leg, then he will stand on the left leg. So then we can know that any of the limbs may not be having any problem. And then we ask the person to walk on a linear path, and if he is able to do it normally, that means the lower limbs are not affected. Then another test is that you just throw small object on the floor and ask the person to pick that object. If he is able to do it, he is able to bend normally, he is able to balance himself, that we know that both his upper limb, lower limb as well as the spinal musculature is okay. And finally, we can ask him to run a short distance. If he is able to do it normally, that means there is no problem. But if he is not able to perform any of these 6 tests, then we have to go into deeper examination of this child or patient in order to assess his locomotor disability. So this is the, in short, the way how to identify the locomotor disability. So I hope that answers your question of early identification.
धन्यवाद डॉक्टर साहब, आपने बहुत ही सरल ढंग से अपने एग्जाम्पल्स के द्वारा हम लोगों को ये बताया कि लोकोमोटर डिसेबिलिटी का अर्ली आइडेंटिफिकेशन किस तरह से किया जाए, और उम्मीद करती हूँ कि हमारे दर्शक भी इससे ज़रूर लाभान्वित हुए होंगे। और अब मैं डॉक्टर धर्मेंद्र कुमार से पूछना चाहूँगी कि लोकोमोटर डिसेबिलिटी की पहचान करने के बाद उसके रेफरल के लिए कहाँ जाया जाए या कहाँ संपर्क किया जाए, और कौन कौन सी सुविधाएं उपलब्ध हैं जिसका हम लोग फ़ायदा उठा सकते हैं। डॉक्टर धर्मेंद्र कुमार।
धन्यवाद डॉक्टर हेमलता। जैसा कि आपने अभी डॉक्टर गोयल ने बताया है हम लोग को कि किस तरह से आइडेंटिफाई किया जा सकता है, लेकिन इसके साथ एक बड़ा ग्रुप रह जाता है जिसमें कि अर्ली आइडेंटिफिकेशन की ज़रूरत पड़ती है और जिसमें वो बहुत ज़्यादा इंपॉर्टेंट होता है। इट इज़ वेरी इंपॉर्टेंट particularly amongst the infants, how to identify disability in them. So I would like to first go through that, tell about that how to identify that in the infants, because that is the one group, if the disability is identified early, then they can be taken care of and the disability can either it can be prevented or it can be corrected to the maximum extent. So to identify the disability amongst the infants, something is very important is that is the birth history of the child. If you go through the birth history, you will find that there had been something wrong when the child was born. Either when he was conceived, the womb at that time, maybe mother had certain infections, maybe she had some injury during that period, and during the birth also there can be the history of delayed birth. Delayed cry, that is important. If the child has cried after a certain duration, normally the child should be able to cry immediately after the birth. The baby should be able to cry. If the child is not crying immediately after birth, that means there had been some kind of the birth anoxia at that time, which can lead to the disability at the later stage. If that is not identified early, means right at the time of birth you can identify whether there is likelihood of some disability or not. Then postnatal conditions, there comes the postnatal conditions. So the child might have contracted some infection that time or some other conditions like jaundice, etc. If they have happened immediately say after birth, immediately after birth the jaundice lasts for some days only, at the most for some weeks. But if it is persisting for a longer time, that can lead to some kind of the disability like cerebral palsy it can lead to. Then if the history of there is that of head injury, means if the child has contracted some injury particularly in the head during the childhood period or during infancy or even immediately after birth, then it can lead to disability. Then there are certain infections which are very well known like meningitis, viral meningitis, encephalitis like Japanese encephalitis, which can lead to the damage to the brain and ultimately can lead to disability. Then the certain infections in the brain which might travel, which might have traveled from some other source of infection, like middle ear infections sometimes can lead to brain abscess. It can lead to disability amongst the infants. Now, the important thing is that when you have to identify early, you have to see for certain things, like the immediately the child is born, you can see certain deformities if they are present, like Dr. Goel was telling about the CTV, congenital talipes equinovarus. The foot is deformed, club foot deformity is there. If there is absence of limb, you can immediately identify there is some disability. Similarly, if the child is supposed to move all the four limbs, when you must have seen the baby, when the baby is playing, is moving all the four limbs symmetrically, means he is able to move all the four limbs. But if the one particular limb is not moving properly, then that means the movement is lacking in that particular part of the body. So you can immediately say, yes, there is something lacking, there can be disability. So that can be identified. The child need to be taken to some expert who can identify, who can diagnose the condition, and the treatment can be started as early as possible. Then there are particularly in the infants is that of cerebral palsy like conditions, like you will find a condition called delayed milestones. At a particular age, a child is supposed to achieve certain milestones, like if you say broadly, means at large, if you can speak, that neck holding should be attained by the age of 3 months. If you see the child which is being shown on your monitor, if you guess the age of the child is not able to sit properly. Ideally, a child should be able to sit by the age of 6 months. But the child, if you look at this child is of 3 years old, and he is not even now able to sit properly. That means there are conditions which are leading to delaying in his milestones. He is not able to achieve what other children of his age group are able to achieve. Similarly, the child should be able to stand by the age of 9 months, 9 months to 1 year. If the child is not able to stand by the age of 9 months, that means at least delayed milestones are there. Then the walking should be, the child should be able to walk, he should be able to take steps by the age of 1 year. If the child is not able to stand, sit, walk by the age of 1 year, that means delayed milestones is there, and the likelihood that the child may be suffering from some neurological disorder like cerebral palsy. Then there can be unusual tone of muscles. The moment you notice that one particular limb the child is not able to move properly, or the child is not able to move a particular part of the body, lower half of the body or one half of the body, means one upper limb and one lower limb, you just have to see whether it is moving like by moving passively. You can know that child is able to whether there is some spasticity, some rigidity, means whether it is difficult to move that limb or not. You can immediately know about that. So that can be identified. Then once you are able to identify the child is having some problem, then the problem comes where he should be taken for a proper treatment. See, it is easier to identify. If the persons who can identify easily are the grandmothers, they can easily see, because they have seen the development of the children, how they have developed, why this child is not developing so properly. And then the mother itself can herself can identify that her baby is not growing so well during as her other children have grown. So if once it is identified, then the child is to be taken to some important place where the diagnosis can be made, proper diagnosis can be made, and the early treatment can be started, because it is always better if the treatment is started early. The child will be able to grow near to the normal, and even if some surgical intervention is required at later stage, that will be minimized. So for that we have got a huge infrastructure available, and if you look even at the block level, we have got primary health centers who are providing these kinds of services. Means nowadays through the programs run by the Rehabilitation Council of India, the doctors at the primary health center all over India have been trained to identify and to start the treatment of the disabled children. Even under Sarv Shiksha Abhiyan nowadays, the program is going on where the identification programs are being held. Doctors are going to the schools and they are identifying the disabled children. So even at the primary health center level, nowadays the facilities are available to identify and start the treatment of the disabled children. Then even at the community health center level, which is a step higher than the primary health centers. This hospital is larger than the primary health center. At the community health center levels also, these kind of facilities are nowadays available. Then at the district level, we have got district hospitals where we have got orthopedic surgeons who can identify the condition. We got pediatricians who can know about the neurological conditions or the lack of development or say delayed development in the child, which can be identified, and the early stimulation procedure can be started. Then we have got DDRCs. Then district disability rehabilitation centers have now been established all over India in nearly 100 districts now. So if somebody wants the list of that, they can write to the Rehabilitation Council of India and can get the list of these DDRCs in their area. Then in these district disability rehabilitation centers, the main work being done is for the identification, early identification, and then the intervention services. The early intervention services are being given at the district disability rehabilitation centers. And apart from that, the non-governmental organizations are also coming in the big way. Earlier on, of course, the non-governmental organizations, they were located in the bigger cities or in the metropolitan cities, but now they have got their centers established even at the district levels, and you will have to identify in your area which non-governmental organization is providing services. In a better way, you have to locate and then reach over there. And if those who are not able to find out where these services are available, they can easily go to the district social welfare officer, because they most of the time have got the list with them, who are the organizations providing services to the disabled persons in their area. Then at the state level, we have got a bigger infrastructure which is nowadays available. We have got under the Ministry of Social Justice and Empowerment, nowadays we have got composite regional centers, and I could get the addresses of 4 of them. One of them is located in Srinagar at Bamina Road. Then the another one is in Lucknow. Lucknow, it is working in a temporary building currently, and that is at this Rosni Nagar near Community Health Center at Lucknow. Then we have got one established in Guwahati, Assam, that is located in Guwahati Medical College campus itself. Then another is located in Sundanagar, Himachal Pradesh. So these 4 composite regional centers are available, which are providing early identification and early intervention services for the disabled persons. Then we have got regional spinal injury centers, means for the benefit of the persons who have contracted spinal injury, even for the children, those who have got myelomeningocele and associated back and their weakness of both lower limbs and bowel and bladder problems, they can be intervened at these regional spinal injury centers. The 4 of them have been operationalized currently. One of them is in Bareilly, Uttar Pradesh. Second is in Jabalpur, Madhya Pradesh. Third one is in Cuttack, Orissa. And fourth one is at Mohali, Punjab, that is near Chandigarh. So these 4 centers have started functioning, which are providing services to the persons with spinal injuries or spinal problems. Then we have got at the apex level, we have got medical college hospitals. The medical colleges hospitals, they also have got the departments of orthopedics, department of physical medicine and rehabilitation, then the departments of pediatrics, pediatric surgery, then the departments of neurosurgery, and it depends what kind of the disability is there, and the person will have to reach to these places depending upon the severity of the disability and the system involved. So if the person goes to the primary health center, the doctor will be able to identify, or at the smaller center, the person will be able to identify the problem with the person, and then we will be able to refer to these higher centers where the specific facilities concerning to that particular problem can be dealt with. Then we have got certain apex hospitals which are providing specific services to the disabled persons, like we have got Safdarjung Hospital, which has got a department of physical medicine and rehabilitation. Dr. Goyal is heading that department in Safdarjung Hospital. Then we have got in Delhi itself, we have got India Spinal Injury Center, which is a big organization made with the Indo-Italian collaboration, located in Vasant Kunj. And then we have got Kalavati Charan Children Hospital located in New Delhi. And then the Kalavati Charan Children Hospital is providing services particularly to the children with cerebral palsy, with the other locomotor disabilities also. Then we have got Government Institute of Rehabilitation Medicine in Chennai. What I meant by these naming these centers is that this is not basically an exhaustive list. There are other centers also which may be located in your area. But the thing is that you have to identify the condition early and then have to reach these centers. Then we have got Apex institutes also which are providing services to the children and persons with disabilities. Like we have got All India Institute of Medical Sciences. There is a Department of Physical Medicine Rehabilitation. Then we have got NIMHANS Bangalore, National Institute of Mental Health and Neurological Sciences, that is located in Bangalore. We have got All India Institute of Physical Medicine and Rehabilitation at Mahalakshmi, Bombay. So in Mumbai also we have got this Apex level institute. Then there is National Institute for the Orthopedically Handicapped in Calcutta. We have got National Institute of Rehabilitation Training and Research located at Cuttack. And then the Pandit Deen Dayal Upadhyay Institute for the Physically Handicapped, which is located in Delhi. I am heading that organization. So specific services are being provided to the locomotor disabled persons at these organizations. And if these organizations are providing services, of course, then there are non-governmental organizations also. The list is exhaustive, I must tell you. The non-governmental organizations are coming in a big way, at least in the disability sector. To name a few, I have got the list of some of the non-governmental organizations at my monitor. You can see at the monitor. Spastic societies, they of course have now recently in the movement for the upliftment of the disabled, services for the disabled, they have started changing their names also. Like Spastic Society in Delhi has changed to the name Action for the Ability Development and Inclusion. Then we have got Amar Jyoti located in Delhi, Karkaduma, Delhi. The Narayan Seva Sansthan is giving big services to the disabled persons located in Udaipur. Then Prema Hospital is there in Visakhapatnam. Then Bhagwan Mahavir Viklang Sahayata Samiti has got its branches all over India. Particularly the main head office is located in Delhi and Jaipur. Then Manglam is located in Lucknow and Delhi. The Kalyanam Karoti is located in Mathura and Meerut. Then Hind Kust Nivaran Sangh is there, which also has got its branches all over India. Then Sri Bidada Trust is located in Bhuj. So these are some of the non-governmental organizations which are providing services to the disabled persons.
डॉक्टर साहब एक भोपाल से एक कॉल है, एक कॉल ले लेते हैं
जी
जी। हेलो, भोपाल से कॉल है हमारे पास।
हेलो
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 यस
हेलो
हेलो, अपना सवाल पूछिए। हेलो
हेलो
अपना सवाल पूछिए।
डॉक्टर पंडित
जी बताइए। जी जी बताइए। हेलो
इंक्रीज द वॉल्यूम प्लीज। हेलो
हेलो
हाँ, डॉक्टर पंडित फ्रॉम CRC भोपाल।
जी सर बताइए।
Addition to the information given by Dr. Dharmendra, there is also a composite regional center at Bhopal, and children could be referred to this center as well.
धन्यवाद।
Thank you, धन्यवाद Dr. Pandit. I am sorry I missed on that, but that's why I have mentioned even in my presentation that the list is not exhaustive. I must have missed a lot of them, because the name of all the organizations cannot be named at the same time. I am sorry I missed that, but of course there is one CRC, Composite Regional Center, which is located in Bhopal. There also the persons and the children can be referred to, where they can avail the facilities for them. Thank you.
डॉक्टर धर्मेंद्र कुमार, आपने काफ़ी विस्तार से हमें जानकारी दी। और जी हमें लग रहा है कि इसमें कुछ और भी संस्थान हैं, कुछ और इंस्टीट्यूशंस हैं जो हमारे देश के विभिन्न भागों में मौजूद हैं, उनसे भी हम फ़ायदा उठा सकते हैं। लेकिन ऐसा नहीं है कि अगर कुछ इंस्टीट्यूट छूट गए हैं तो उनको कुछ जानबूझकर या उस तरह से छोड़ा गया है। तो कृपया अगर इस तरह का कुछ है तो आप हमें ज़रूर लिखें। जी, रांची की कॉल दें। हेलो हेलो।
हाँ
हेलो जी, सवाल पूछिए अपना।
हाँ, रांची से बोल रहे हैं
जी, हेलो,
ये
अपना सवाल
हम लोग
पूछिए।
रांची जिले के नामकुम प्रखंड में विकलांगों के लिए सामुदायिक पुनर्वास कार्यक्रम का संचालन कर रहे हैं।
जी,
इसके अंतर्गत बहुत सारे जो लोकोमोटर डिसेबिलिटी से ग्रसित बच्चे हैं, जैसे सीटीबी, पीपीआरपी और डेवलपमेंटल डिले के जो केसेस हैं,
जी,
उनका हम लोग उचित पुनर्वास सेवा उपलब्ध नहीं करा पा रहे हैं।
जी,
क्योंकि नामकुम प्रखंड में जो प्राइमरी हेल्थ सर्विस सेंटर है वो बहुत सक्रिय नहीं है, और वहाँ जब भी जाते हैं तो लोग बोलते हैं कि सुविधा का अभाव है। इसलिए सीटीबी और पीपीआरपी से ग्रसित जो बच्चे हैं उनका शल्य चिकित्सा उपलब्ध नहीं हो सकता है। अतः कोई ऐसा कानूनी प्रावधान या प्रक्रिया बतलाएं कि हम इन बच्चों के लिए वहीं पर चिकित्सा सेवा उपलब्ध करा सके।
डॉक्टर धर्मेंद्र कुमार, आप इसके बारे में बताना चाहेंगे?
जी, ये तो देखिए आपने बड़ी अच्छी बात कही है कि आपके यहाँ पे जो है केंद्र होने के बावजूद सुविधाएं उनको उपलब्ध नहीं कराई जा पा रही हैं। तो कानूनी प्रावधान की जहाँ तक बात है वो तो बात अलग है। यहाँ पे हम आपको सिर्फ इतना बताना चाहेंगे, अगर आपका केंद्र आपको सेवाएं नहीं दे पा रहा है तो आप किसी और केंद्र के माध्यम से सेवाएं प्राप्त कर सकते हैं, जिसमें कि जो भारतवर्ष की जो हमारा मंत्रालय है, सामाजिक न्याय और अधिकारिता मंत्रालय, उसकी एक स्कीम है जिसको हम एडिप स्कीम बोलते हैं। उसमें एक्सटेंशन प्रोग्राम जो हमारे नेशनल इंस्टीट्यूट्स के हैं उसके माध्यम से आप सेवाएं प्राप्त कर सकते हैं। आप जो 3 नेशनल इंस्टीट्यूट्स हैं लोकोमोटर डिसेबिलिटी के क्षेत्र में जो कार्य कर रही हैं, जैसे नेशनल इंस्टीट्यूट फॉर द ऑर्थोपेडिकली हैंडीकैप्ड है कलकत्ता में, उसके अलावा दूसरी नेशनल इंस्टीट्यूट ऑफ रिहेबिलिटेशन ट्रेनिंग एंड रिसर्च है हमारी कटक में, और तीसरी जो मैंने आपको बताई है पंडित दीनदयाल उपाध्याय इंस्टीट्यूट फॉर द फिजिकली हैंडीकैप्ड दिल्ली में है। तो इनके विस्तार कार्यक्रम के तहत आप उनको एक पत्र लिख सकते हैं कि आपके यहाँ पे कैंप के माध्यम से ये सुविधाएं उपलब्ध करा सकते हैं वो। और अगर उसमें करेक्टिव सर्जरी की भी ज़रूरत है, ऑपरेशन अगर नहीं हो पा रहे हैं, तो वहाँ पे आपके जो जिलाधिकारी हैं उनके सहयोग के माध्यम से कोई कैंप आयोजित किया जा सकता है जिसमें उन बच्चों को ये सुविधाएं उपलब्ध कराई जा सकती हैं। तो आप किसी इन 3 संस्थानों में से किसी के भी एक निदेशक को आप पत्र लिख दीजिए, वो आपके यहाँ पर आपके जिलाधिकारी के माध्यम से आपके यहाँ पर कैंप का आयोजन करवा के आपको सुविधाएं उपलब्ध करवा सकता है। इसके अतिरिक्त जो ऑर्गेनाइजेशंस हैं, बहुत सारे नॉन गवर्नमेंटल ऑर्गेनाइजेशन, जैसा मैंने बताया, इसमें 2-3 का मैंने नाम भी लिया। एक है आपका नारायण सेवा संस्थान है उदयपुर में, जो करेक्टिव सर्जरी के कार्यक्रम आयोजित करवाते हैं, आइडेंटिफिकेशन और उसके भी करवाते हैं, एड्स एंड अप्लायंसेस डिस्ट्रीब्यूशन के। इसके अतिरिक्त मंगलम है और कल्याणम करोती है, और महावीर विकलांग सहायता समिति भी ये कार्यक्रम आयोजित करती है, कैंप के विस्तार के कार्यक्रम आयोजित करती है। और इनके माध्यम से आप इनको भी अगर पत्र लिखेंगे, अगर तो ये भी मैं जहाँ तक मैं समझता हूँ आपकी मदद के लिए आएंगे। और आपके क्षेत्र में अगर सेवाएं उपलब्ध नहीं हो रही हैं तो अपने जिला कलेक्टर को आप लिखें, उनको लिखिए आप कि आपके यहाँ पे इस तरह की समस्या है और उनको बच्चों को इसकी सुविधाओं की आवश्यकता है, तो वो आपको सुविधाएं उपलब्ध कराई जाएंगी।
डॉक्टर तो एक चीज़ मैं भी कहना चाहूँगा कि जो सवाल पूछा गया है कि प्राइमरी हेल्थ सेंटर पर शल्य चिकित्सा की सेवाएं उपलब्ध नहीं है, जो हमारा गवर्नमेंट का इंफ्रास्ट्रक्चर है उसमें प्राइमरी हेल्थ सेंटर पर कोई प्रावधान नहीं है सर्जरी का। तो कायदे से जो रेफरल होना चाहिए इस केस में, वो डिस्ट्रिक्ट हॉस्पिटल में आप रेफ़र अगर करेंगे तो ये सब सुविधाएं वहाँ आपको ज़रूर मिलेंगी झारखंड में। तो मेरी आपसे गुजारिश है कि आप डिस्ट्रिक्ट हॉस्पिटल को संपर्क करिए, तो वहाँ पर आपको ये सब सेवाएं मिल जाएंगी। और उसके अलावा अगर दिक्कत आती है तो जैसा डॉक्टर साहब ने बताया है कि कैंप अप्रोच के द्वारा ये सब संस्थाएं इस टाइप की सुविधाएं उपलब्ध कराते हैं, तो वहाँ भी आप जा सकते हैं।
डॉक्टर गोयल, कई बार ऐसा देखा जाता है कि जो लोकोमोटर डिसेबिलिटी है वो लेप्रोसी की वजह से भी होती है, तो अगर लेप्रोसी है उसकी अर्ली आइडेंटिफिकेशन कैसे किया जाए? हम कैसे जान सकते हैं कि लेप्रोसी है?
लेप्रोसी में अभी मैं आपको शुरू में बता रहा था कि लेप्रोसी में जो अर्ली आइडेंटिफिकेशन है उसमें 2-3 चीज़ें मोटी मोटी ज़रूर देखनी पड़ती हैं। लेप्रोसी की जो पहचान है, सबसे पहले हमें स्किन एग्जामिनेशन करना पड़ता है। स्किन में कुछ सफ़ेद रंग के धब्बे हो जाते हैं, और अगर हम उसको गहराई से उसका मुआयना करें तो वो धब्बे अगर आप उसको वहाँ पर छू कर देखेंगे तो वो धब्बे, उसमें सेंसेशंस नहीं होते हैं। तो ये लेप्रोसी के शुरुआत के लक्षण हैं। अगर इस प्रकार का कोई भी व्यक्ति आप आइडेंटिफाई कर पाते हैं, उसमें अगर आप उसको डॉक्टर को रेफ़र कर दें समय से, तो दवाई के द्वारा लेप्रोसी को अरेस्ट किया जा सकता है। और जैसा मैं पहले बता रहा था, जो इससे डिसेबिलिटीज़ हो जाती हैं कि हाथ और उंगलियां जो हैं वो डैमेज हो जाते हैं, डिजिट्स का लॉस हो जाता है, उन सब चीज़ों से हम उस पेशेंट को निजात दिला पा सकते हैं और उसकी डिसेबिलिटी वहाँ तक नहीं पहुँचेगी। तो ये एक अर्ली आइडेंटिफिकेशन का तरीका है। बाकी तो अगर वो बीमारी ज़्यादा बढ़ चुकी है तब तो आप उसमें यही देखेंगे कि उसको अल्सर्स हैं, उसको हाथों की उंगलियां नहीं हैं, डिफॉर्मिटी है फेस पर, नोज़ पर, कई बार अंधपन भी आ जाता है आँखों में। तो ये सारी चीज़ें अगर उसमें हैं तो वो पेशेंट को लेप्रोसी है।
जी धन्यवाद डॉक्टर साहब। हमारे पास अब एक कॉल है, कॉल दीजिए प्लीज़।
Hello.
हेलो।
I question to Dr. Goyal whether it is
Yes.
possible to determine or identify locomotor dysfunction through genetic studies, sir.
Through what studies?
जेनेटिक स्टडीज।
Yeah, genetic studies.
Hello?
Yeah, genetic studies, we can detect the problems in the womb which are genetic in origin, but presently these are available in very limited manner at major apex institutes. As Dr. Dharmendra was telling, that very few institutions are having these facilities, and in
Hello?
our capital city we are having a genetic engineering lab at the All India Institute of Medical Sciences. You can refer such cases for genetic studies for detection of the disability. Anything you want?
हाँ, इसमें जो as far as genetic problems is concerned, as the Dr. Goel ne, he has already told that through genetic detection it can be done, but there is one procedure which is called amniocentesis, and by doing the amniocentesis the congenital problems can be identified. There is one protein which is called as alpha fetoprotein, which if it is present there in the amniotic fluid, then it is said that maybe the child has got congenital anomalies even before the total parts of the body are developed. And once the body parts start developing, the congenital problems, they can be identified even by the ultrasound. Ultrasound can detect the congenital anomalies in the children which are there in the womb at the time of pregnancy itself.
डॉक्टर साहब, एक सवाल जो बार बार हमारे सामने आता है कि रिकेट्स जो है ये एक बीमारी है, और इसका जो अर्ली आइडेंटिफिकेशन है वो कैसे किया जा सकता है?
रिकेट्स एक ऐसी प्रॉब्लम है जिससे कि लोकोमोटर डिसेबिलिटीज़ काफ़ी देखने में आती है, स्पेशली जो बच्चे हैं उनमें ये चीज़ पाई जाती है। बेसिकली रिकेट्स क्या है कि इसमें बच्चे की बोन्स काफ़ी सॉफ्ट होती हैं, क्योंकि इसमें बच्चे में कैल्शियम एंड विटामिन डी की डेफिशिएंसी होती है। क्योंकि बोन्स की ग्रोथ हो रही होती है बचपन में, और बोन्स इतनी स्ट्रांग नहीं होती कि बच्चे का वेट ले पाएँ, तो वो मुड़ने लगती हैं, तो उससे डिफॉर्मिटीज़ हो जाती हैं। मैंने पिछली स्लाइड में आपको दिखाया था कि उसके घुटने अंदर की तरफ टांगें जो हैं घूमने लगी हैं। तो ये एक बड़ी कॉमन डिफॉर्मिटी है जो कि रिकेट्स में दिखाई देती है। तो इससे आप आइडेंटिफाई कर सकते हैं। इसके अलावा आप और दूसरे जॉइंट्स का एग्जामिनेशन करेंगे तो आप पाएंगे कि रिस्ट पर अगर आप देखें तो कई बार वहाँ पर थोड़ी स्वेलिंग होती है, सूजन होती है, और दबाने से आपको पेशेंट कंप्लेंट कर सकता है कि उसको दर्द हो रहा है। साथ में छाती में भी कई बार उठाव हो जाता है। वो ये सब चीज़ें इसी वजह से होती हैं कि बोन्स जो हैं वो मुलायम होती हैं। उसकी वजह से जब वो डेवलप हो रही होती हैं तो उनके ऊपर ज़्यादा लोड पड़ने से वो टेढ़ी हो जाती हैं, उससे डिफॉर्मिटीज़ हो जाती हैं। फ्रंटल बॉसिंग एक दूसरी और उसको आइडेंटिफाई करने का तरीका है कि जो हमारी जो ये फेस जो माथे की हड्डी है ये भी उठी हुई होती है। तो ये कुछ सिम्टम मीन साइंस हैं जिससे कि हम आइडेंटिफाई कर सकते हैं रिकेट्स की वजह से लोकोमोटर डिसेबिलिटी को।
तो डॉक्टर साहब ये बताएं कि इससे बचने के लिए जैसे माता पिता क्या ध्यान रखें कि उनके बच्चों को ऐसा ना हो, कुछ चीज़ें हैं
ये अहम इसमें तो बहुत कुछ कहा जा सकता है, क्योंकि जैसा मैं बता रहा हूँ कि ये कुछ डेफिशिएंसी से होता है। अगर हम उस डेफिशिएंसी को पूरा कर दें तो बहुत से हमारे जो बच्चे हैं वो इन बीमारियों से बच सकते हैं। रिकेट्स के मामले में उसको प्रॉपर न्यूट्रिशियस डाइट दिया जाए जो कि भरपूर हो विटामिन डी में, कैल्शियम में। जैसे कि मिल्क जो है एक बहुत ज़रूरी चीज़ है जो कि हर बच्चे को मिलना ज़रूरी है। माँ के दूध की तो आपको पता ही है कितनी इम्पोर्टेंस है कि बच्चे को मदर्स मिल्क देना कितना आवश्यक है। और उसके बाद भी जब बच्चा ग्रो कर रहा होता है तो उसके डाइट में प्रॉपर मात्रा होनी चाहिए दूध की, जिससे कि रिकेट से उसको बचाया जा सके। आजकल जो बड़े घरों के बच्चे हैं उसमें हम देखते हैं कि वो बहुत ज़्यादा प्रोटेक्टिव हैं, जंक फूड ज़्यादा खाते हैं, घरों में ही रहते हैं, गाड़ियों में ही जाते आते हैं, तो उनको सूरज की भी रोशनी जो है भरपूर मात्रा में नहीं प्राप्त हो पाती, जो कि सूरज जो है जो हमको उसकी किरणें विटामिन डी देती हैं, तो कैल्शियम और विटामिन डी दोनों ही नहीं मिल पाता है। तो ये चीज़ ज़्यादा आप देखेंगे रिकेट्स रिच फैमिलीज़ के बच्चों में आजकल ज़्यादा देखने में आई है। आज ही इसमें आर्टिकल भी आया हिंदुस्तान टाइम्स में, आपने शायद पढ़ा होगा कि जंक फूड पर स्टडीज़ हुई हैं। तो इसमें सबसे ज़्यादा जो रोल है वो न्यूट्रिशियस डाइट का रोल है।
धन्यवाद डॉक्टर साहब। चेन्नई से एक कॉल है हमारे पास।
Hello.
हेलो।
It's a question to Dr. Goyal.
यस, प्लीज आस्क योर क्वेश्चन।
Sir, children with rheumatic arthritis in young age, is it possible to lead to permanent locomotor disability?
Yes, definitely. We have to first of all detect this disease of rheumatic arthritis in children, and if they are referred to the pediatricians in time and they are given proper treatment, diagnosed properly and given the proper prophylactic treatment, then they will not go into deformities later on and cardiac defects, and that way we can definitely prevent the locomotor disability from occurring.
डॉक्टर धर्मेंद्र कुमार, संभव है कि इसकी अर्ली आइडेंटिफिकेशन करके कुछ रोकथाम की जा सकती है?
लेकिन ज़्यादातर केसेस में इसी तरह का पाया जाता है कि बच्चों को दवाई नहीं दिलवाई गई है, उसके बाद पोलियो हो रहा है।
धन्यवाद डॉक्टर साहब। डॉक्टर गोयल, एक छोटा सा सवाल चलते चलते पूछना चाहूँगी कि ये जो रोड एक्सीडेंट्स हो रहे हैं इनका प्रिवेंशन कैसे किया जाए?
ये सवाल तो खैर बहुत छोटा नहीं है, क्योंकि आप बिल्कुल समय बहुत कम है। तो रोड ट्रैफिक एक्सीडेंट की समस्या बहुत बड़ी समस्या है, और हम सब जानते हैं कि उसकी वजह से डिसेबिलिटी लोकोमोटर कितनी बढ़ती जा रही है। रोड ट्रैफिक एक्सीडेंट डेफिनेटली मतलब प्रिवेंटेबल हैं, उसमें हम सबको योगदान देना है कैसे उसको प्रिवेंट किया जा सकता है। इसमें ज़्यादातर जो होते हैं ये एक्सीडेंट या तो गाड़ी चलाने वाले की गलती से होते हैं, या जो सड़क पर चल रहा है उसकी गलती से होते हैं, या जो ट्रैफिक का रेगुलेशन कर रहा है, पुलिस जो ड्यूटी पर होती है उनकी गलती से होते हैं। और चौथा होता है एनवायरनमेंट, कि जैसे बादल आ गए हैं, बारिश हो रही है, आंधी आ रही है, तो उसमें विजिबिलिटी वगैरह पुअर हो सकती है। और पांचवा जो है, जो गाड़ी है, जो भी साधन है जो चला रहे हैं सड़क पर, तो उसकी खराबी की वजह से होता है कि ब्रेक ठीक से नहीं लग रही है, शीशा टूटा है या धुंधला है। तो इन 5 चीज़ों को जो कारण हैं, इनको हम ठीक कर लें तो रोड एक्सीडेंट्स बिल्कुल टोटली प्रिवेंटेबल है। ये शॉर्ट में मैंने आपको बताया
जी। जानकारी बहुत अच्छी रही और हमारे पास अभी बहुत इच्छा है कि हम और जानकारी इस बारे में लें, लेकिन समय जो है वो समाप्त हो रहा है। डॉक्टर गोयल और डॉक्टर धर्मेंद्र कुमार ने हमें लोकोमोटर डिसेबिलिटी के बारे में बहुत महत्वपूर्ण जानकारी दी और मैं आपका धन्यवाद देती हूँ कि आपने इतना बिजी शेड्यूल में से समय हम लोगों के लिए निकाला। और इसी तरह की जानकारियाँ लेकर हम आपके सामने हर हफ्ते आते रहेंगे। मैं एक बार बता देना चाहूँगी कि हमारी अगली टेलीकॉन्फ्रेंस का विषय है अर्ली आइडेंटिफिकेशन एंड रेफरल इन मेंटल इलनेस। मेंटल इलनेस का आइडेंटिफिकेशन और रेफरल के लिए क्या किया जाए, और इसके लिए हमारे साथ हमारे बहुत महत्वपूर्ण एक्सपर्ट डॉक्टर अचल भगत होंगे। अगले हफ्ते 11 बजे से 12 बजे तक का समय रहेगा। और अंत में मैं इस टेलीकॉन्फ्रेंसिंग कार्यक्रम से जुड़े हुए EMPC के सभी कर्मचारियों, अपने दर्शकों जिनके सक्रिय सहयोग की वजह से ये कार्यक्रम सफल रहा, और अपने एक्सपर्ट्स का धन्यवाद अदा करती हूँ। धन्यवाद।